Right, let's bring you more news related to COVID now, and this is about a fast-spreading, highly mutant subvariant that has been detected. Now, a subvariant of the highly contagious Omicron coronavirus strain, which some studies indicate could be even more infectious than the original version, has been detected now in 57 countries, according to the WHO. Now, this fast-spreading and heavily mutated Omicron variant has rapidly become the dominant variant worldwide since it was first detected in southern African countries 10 weeks ago. In its weekly epidemiological update, the World Health Organization said that the variant, which accounts for over 93% of all coronavirus specimens that they're collecting in the past 1 month, counts several sublineages as well. It's BA.1, BA.11, but specifically BA.2 is the one that is now, according to the WHO, a fairly serious cause of concern. What exactly do we know about this, and what's really should be our outlook towards this new subvariant? To talk about that, we've got our doctors with us this morning. Joining us is Dr. Ravi. Kolli is a senior psychiatrist as well. Thank you so much for your time, Doc. And also with us is Dr. Lokesh, Edara, senior physician, joining us from the United States. Dr. Lokesh, if I can begin with you, what exactly do we know about this variant so far?
Actually, this is new variant, so in the real world data, we don't have exactly. But when you follow the South African model, they take the isolation off from the asymptomatic patients, and all the cases are coming down across the most of the countries, such as UK, taken off it. So we have to watch next couple of weeks, see what's whether any increase in the mortality or anything. But currently, it may be spreading like other one, but most of the countries, we're seeing the downfall of the numbers.
All right, downfall of the numbers, but in terms of transmissibility, in terms of seriousness, we are basically trying to understand, will this take more lives? And the second question, in fact, on that is, will it escape immunity? Dr. Ravi, if you could give your thoughts on that.
Yeah, good morning, Sonali. Thanks for having us. Like you said, the variant is more infectious and more people are getting infected. About in the USA, 500,000 new infections every day and 2,000 people are dying every day. So even though the severity of the illness is milder because it's affecting more people, some of them are going to die. So it cannot be taken lightly, and it still has to be taken very seriously and have to be very cautiously approached by vaccination and all the precautionary measures we are all supposed to take. So it's not time to lighten up, even though we might be tired of COVID. COVID is not tired of us. It's still wreaking its havoc on us, our lives.
Right. Dr. Lokesh, then, when the year 2022 kicked in, there were lots of reports and very senior people, even at the WHO, saying that this just might be the beginning. This year just might be the beginning of the end of the pandemic as we know it. It might turn into an endemic later, especially with the way Omicron had behaved. Does this new variant sort of is in line with what they had thought, or do you think this could derail plans and understanding of the virus so far?
I think it's too early to say it derails the plan, because Omicron itself, even if I get infection before, even if I am vaccinated 3 or 4 times, I still be getting, whole world will get the Omicron. So this way, so we are all going to get, when you look at the Spanish flu, 1918, 1920, there are 3 years it spread. So most of the pandemic, the scientists think we have started in 2020, 21, 22, we'll go in the next 6 months. So, and we're a herd immunity because we're getting everybody, 7 billion people will get it. So most of the time we're seeing lesser severity, except elderly and immunocompromised. So we have to wait for next 3-4 weeks, this the B2 variant, what it behaves. But I have not seen the real reports of really seriousness, but the infection is mixing together. That's my, at least my data analysis.
I see. Dr. Ravi, then the fact that this is emerging out of Africa, one could argue at a very basic level that it is because of vaccine inequality as well, that in that part of the world we actually see new variants coming in. How concerned are you about that? Something, again, the WHO has been raising time and again?
Yeah, even though it might have been first detected in Africa, doesn't mean that it has only started there. it's likely that the mutation has been taking place everywhere. Wherever people are unvaccinated, most likely they harbor the virus, and they're probably more likely to have a mutant happening in their system. So we cannot just pinpoint any one place or geography to attribute this spread. For example, most of the infections that are happening in the United States are now Omicron variety. So regardless where it started, it's now everywhere, and there's no escape from that. So the fact is that people who are vaccinated have a lesser risk of hospitalization and deaths is the key point everybody has to remember. We all need to be updated with our vaccination schedule and not to kind of ignore the vaccination as the key to our kind of exit strategy from this status of pandemic.
The fact that we're at least talking about an exit strategy is comforting at some levels. But Dr. Lokesh, let me come to you. Could you sort of break it down for us? If it's a subvariant of Omicron itself, it cannot be technically more dangerous than Omicron, can it?
Well, it is because the more data there, we don't know exactly the information, how the news is coming more forward than the research publications. So it is, since we started alpha, now it is Omicron. This is almost like 15 variations. Only 3 cases came through. One is where we have less vaccinated, and Delta started in India, and the Omicron started in South Africa, mostly in HIV patient immunocompromised, where they are less vaccinated. So the original virus is alpha. All the other variants did not went through. So I think I'm going to wait for my judgment next. What happens? They look at the real numbers, then only I can respond. So far, things are much liberal than what BA2, but I have to wait for 2-3 weeks to look at more detail. And they may want to be variant, or they may name a new one if it is so much of concern.
I see. Dr. Ravi, your thoughts on just understanding the extent to which a subvariant can go in its basic character different from from Omicron?
Yeah, I think we can assume the variants can be milder, but that was not the case with the Delta, because the severity was severe than even original virus. So not necessarily each subvariant will be less severe, but luckily Omicron is less severe because the virus wants to replicate, virus wants to spread, virus wants to live in the body. So it cannot kill the people, then it won't exist. So virus wants to survive in the body of the patient. So it tends to kind of mutate to the point where they can coexist with the patient. So that is how the viruses can behave. They have their own mind and their own evolution and their own survival, and depends on our own survival to some extent.
Right. I'm just reading a couple of reports that have come in from the UN Health Agency, where they say, like you've also been saying, little has been known yet about the differences between the subvariants, and it has called for studies into characteristics, including transmissibility, how good, and again, it is at dodging immune protections and its virulence as well. Several studies have hinted, however, that BA.2 is more infectious than Omicron. Nothing known about its immune escape or how dangerous it can get. But Maria Van, one of WHO's top experts, actually did say that information about subvariant was very limited, but some initial reports that have come in do indicate a slight increase in the growth rate over BA2. So far, we only know that it just might be more infectious. That is, it will cover more people and spread more quickly than Omicron. But key again, Dr. Lokesh, it will really come down to the fact on whether or not it is showing any immune escape on vaccines, and second, really how dangerous is it getting in terms of, and that's actually related. If it escapes vaccine immunity, then it actually gets down to being more fatal.
Omicron itself, it evaded the immunity because, as I said before, he had infection, people got Omicron, vaccine, people got Omicron, but it seems to be very milder compared to the Delta. So I looked at the data even today. South Africa data comes, the new cases are 3,000. It went up to 32,000 down to 3,000, and they just removed the isolation for even asymptomatic today. So that's where I am still at it. We need to look at the real data before we jump on to this one. But you're right. So all this, another point I'll make. Even though Spanish flu is 100 years old, we are dealing with flu every year, even now. In the USA, you go to CDC website, look at it, we're losing 15 to 20,000 people every year in USA. We as the physicians, we get flu vaccination every year for last 20, 30 years. Otherwise, we don't get privileges in the hospital. So we are going to do another 100 years with this virus, maybe milder form. So that's the real fact. Some subvariants comes, but we focus is more detail now than because this is a pandemic.
I see. Closing comments from you, Dr. Ravi?
Yeah, it is. The thing is, like Dr. Edara said, it's going to be there. We have to live with it. It's not a new normal, it's a next normal. The normal is going to keep on mutating our normalcy as well. So, but there's another issue that we need to deal with, the long haul syndrome, how all the people who are mildly affected may have some long-term consequences as well. So it's going to have a burden on our system, but we cannot be pessimistic about it. I think we have some options. We have some protections. It's not escaping the immunity, but actually the immune effects of the vaccine are receding after time. So then people are getting sick from the virus exposure, and each person reacts differently to the vaccine. So vaccines are effective to some extent, even to the variant, but the vaccine reaction and vaccine effects are variable in people, and also with the time, the effectiveness of the vaccine also reduces. So vaccine and updating vaccination will probably become the norm, the new norm or next norm.
So more and more variants, I think the sense I'm getting, and Dr. Lokesh, correct me if I'm wrong, is not just about lives being lost, but it's about economies being hurt here as well. Yeah. You will need to develop more and more vaccines. There will be more and more sort of spending happening there. More governments will have to come out and ensure that people are protected. So these new variants do pose a threat in a way.
Yes, the variants they will going to see. As I said, for the last 100 years, we're seeing the different thing. They keep changing every year, get the flu vaccination. So the COVID will be added to the flu. We're going to get a vaccine once a year. But the USA is the only one who got the flu vaccines for the last 20 years. But now rest of the world will be more focusing on it and be getting these vaccinations to keep our economy going. And we have to we have to move on. We cannot keep our hands tied with the virus. We keep on moving and be careful. That's all.
Yeah, we got to live with the virus, but be careful about it. Don't invite it upon yourself. We still don't know what it is going to do to us, to our bodies in the coming years. Thank you both for joining us this morning.